Good morning, my respected teacher and judges. I myself, Dr. Samiran Sinha, presenting today on the topic of decoding file for easy understanding, guided by Professor Dr. Devaprasad Das, Dr. Anirban Bhattacharya, Dr. Asim Vikas Maiti, and Dr. Sheikh Mehboob Rahman. One of the most important stage of the root canal treatment is shaping, which is mechanical debridement procedure and prepare the canal for three-dimensional obturation. For this reason, various instrument is developed to minimize the procedural error and to save time. The nitty rotary endodontic instrument have various advantages over traditional hand instrument because of continuous modification of their designing characteristics. My motto is to highlight the basic design feature and their correlation to choose operator the right instrument for every case. The root canal shaping instrument can be divided into hand instrument and mechanically driven instrument. Mechanically driven instrument further divided into rotary and reciprocating. Basic part of the rotary shaping instrument are attachment section and walking section. Walking section further divided into non-cutting part, cutting part, tip. Tip may be active or passive. Cutting part further divided into primary and secondary. Secondary are taper length. Primary or fluting contains helical angle, pitch, depth and volume and configuration of the fluting. Basic design of root canal rotary instrument. Attachment section which attaching to the handpiece and transmit torque to the walking section. Non-cutting part is a smooth cylindrical part which attaching the cutting part to the attachment section. There is one or more measuring cylinder and rubber stop for controlling the working length. Tip, the end point of the cutting part of the instrument. It guides the instrument into the canal. Active tip has the cutting edge on its surface, helps to remove obturating material and penetration to calcified canal. But its prominent disadvantage is that perforation or ledge formation when deviation from the canal axis occurs. Passive tip does not have any cutting edges and so it reduces the risk of deviation from the canal axis as a consequence. Primary cutting part, helical angle, pitch, depth and volume of fluting, configuration of fluting. Pitch is the distance between the edge of two nearby cutting blades or number of the spiral of fluid per unit length. Helical angle, an angle between instrument axis and tangent of cutting edge. Instrument with large helical angle and a small pitch have an essential drawback, resulting in increasing a screwing effect and separation of the instrument. It is better to use varying helical angle and pitch, which decreases the screwing effect and also decreases the torsional overloading upon the root canal instrument. Pitch and depth of fluting determines its volume. Greater the volume, more substrate or debris can be removed from the root canal wall per unit length of insertion, resulting in reducing the time needed for root canal preparation and decreases the number of rotation cycle. So decreasing the cyclic overloading of the instrument, it is better to use in curved root canal where cyclic overloading is high. Elements of cutting blades are surface and angles. Surfaces are face surface, flank surface, cutting edges, radial end. Face surface of the cutting blade first contacting with the substrate layer and the chip towards rotation. Surface of the flank surface of the cutting blade facing the machine surface of the dentin. Cutting edge, it is the meeting point of face surface and the flank surface. Radial end, surface that projects axially from the central axis, that is the amount of the material supporting the cutting blade of the instrument. More the radial end, more resistant to torsional forces, less chances of instrument separation, and combination of non-cutting tip and the radial end keep a file centered in the canal. Cutting property of the instrument are determined by the cutting angles. Different angles are clearance angle, wedge angle, angle of cutting, and the rake angle. Clearance angle, angle between the flank and root canal wall. It determines the frictional force arising during cutting process and the degree of instrument penetration into the substrate. The less clearance angle, harder the blade penetration into the instrument, the lower the cutting efficiency. Wedge angle, angle between the face and flank, it determines the strength performance of the blade. Greater the wedge angle, stronger the blade. Angle of cutting, sum of wedge angle and the clearance angle, it determines the cutting power and force. Rake angle, position of the radial line in respect to face of the blade. It determines the cutting efficiency of blade. It may be positive or negative. Positive rake angle when face of the blade is behind the radial line, which makes the wedge angle acute and intense, which causes the instrument very active to cut the dentinal surface of root canal wall. Negative rake angle when face of the blade is in front of the radial line, which makes the instrument less aggressive and protecting the tooth surface from the scraping during work. Taper, the ratio of diameter at different point of cutting part. It increases from tip towards shank along the cutting part of the instrument length. A taper shape decreases the torsional load upon the instrument due to reduction of contact area between blade and root canal wall, where a large taper decreases the instrument flexibility, resulting in increase the cyclic overloading of the instrument. Thank you.
Thank you very much, Dr. Sinha.
Thank you.
Any questions from the audience? Okay. Just remember one thing, that means I know you are in first year. Please develop an habit of not reading through, looking at the slide. That means just mention some point and you have to elaborate on it. One question to you: when should you advocate using a non-cutting tip? I'm not going to ask you any difficult question. Maybe what is your take? Maybe a non-cutting tip. When should you advocate? In which type of canal? Any idea? I know you are just in first year, but what is your take on that?
Most of the cases we can use the non-cutting tip because it prevents leach formation and the perforation.
Are you sure?
Yes, sir.
Okay, thank you very much.
Thank you, sir.
I think it would be a privilege for you to receive a certificate from your PG guide. That is why specifically I invited you.